Hello, my name is Summer Chrissiana, and today we'll be following two college students with vaginal ailments. Autumn suffers with Polycystic Ovarian Syndrome, and Farrah overcame ovarian cysts. Polycystic Ovarian Syndrome, also known as PCOS, is a hormonal disorder causing enlarged ovaries. The cause is unknown, but may be linked to a combination of genetic and environmental factors. Some symptoms are acne, irregular cycles, hair growth, and obesity. Experts say high levels in androgens and high levels of insulin may also contribute to this cause of PCOS. An ovarian cyst is a fluid-filled sac. It can form in many places in the body. Ovarian cysts form in or on the ovaries. They are usually non-cancerous. Ovarian cysts are common in women with monthly cycles. Most women make at least one corpus or follicle cyst each month. You may have a cyst and not be aware until it grows in size and causes problems such as bloating, frequent urination, abdominal pain, pelvic pressure, or abnormal vaginal bleeding. Experts say there are no cures for PCOS, but medication to balance hormones. Ovarian cysts can be removed surgically, or doctors may prescribe birth control or pain relievers. Let's take a look at Autumn's experience with Polycystic Ovarian Syndrome and Farrah's experience with an ovarian cyst.
My name is Autumn Patterson. I'm 20 years old and I have Polycystic Ovarian Syndrome.
My name is Farrah and I'm 22 years old. I had an ovarian cyst.
It's an up and down, day-to-day type of experience. Sometimes I have really bad symptoms, a lot of cramping. Sometimes I don't have any cramps at all. My menstrual cycles can be on and off, irregular, and sometimes my birth control sometimes doesn't work. So
I woke up one night suffering from severe pain in my lower abdomen, and I decided to go get checked at my doctor. They found a small almond-sized cyst in my left ovary.
When I first got the diagnosis, I didn't have any cramps when I first started my menstrual period, and then later on they were really bad to the point where I had nausea, I was fainting, to the point where I went to the doctor and of course got the diagnosis. Sometimes it's fatigue, lack of water, so dehydration at sometimes.
I felt heaviness and fullness, and I either skipped my period or it came really late. I also suffered from severe cramps around the time of my period.
I was diagnosed around 16. I went to the doctor because earlier when I started my cycle, I didn't have any cramps at all for about a couple of years. And then around 17, the cramps just came, all hit at one time. It's like it was coming back to make up for lost time. So I went to the doctor and I told them that my periods were on and off. Sometimes it would be 3 months, sometimes it would be 2 weeks, and I would have another period. So I wanted to go get that checked just in case.
I was diagnosed when I was 20, so 2 years ago. And one of the nights I suffered from really intense pain in my lower abdomen. And that's why I decided to go to urgent care that night.
My mom and my grandma haven't had that diagnosis before. I'm not sure any farther back or any other relatives, but as far as I know, it's just me and my family.
No, it doesn't run in my family.
It's affected my cycles. I can't really time it from month to month. It's kind of, I have to be on standby every day mostly. For my sex life, it's kind of difficult. Some of the symptoms that may be infertility, so that's one thing that I'm kind of worried about if I do want to get pregnant or not. Health-wise, just to stay hydrated, and when I do have those cramps that are really bad, drink a lot of tea and focus on my birth control, make sure that it's working effectively.
I generally just felt really anxious because I didn't know what was happening and going on with my body. It was also really worrying that my period was so unorganized, and also there were chances of infertility, so that really made me scared.
I was prescribed Marizia, I think. It was the birth control contraceptive, the oral, and It was working pretty well for me, but I realized my mom and my grandma had problems blood clotting really bad in their lungs, and they were on the birth control pill. So we switched over to the IUD. My doctor suggested the IUD.
I was prescribed low-dose birth control to regulate my hormones.
I would say that it's not unlivable. You can maintain your health throughout. I do just say keep a good diet, exercise a lot just to keep your body in tune. It will help better with the cramps and for the menstrual cycles, but it's something that you can definitely live with.
I think the most important piece of advice is to immediately seek help if you feel like your period is irregular and that you're getting a lot of cramps, because I waited a long time and ignored the pain and ignored the symptoms before I did anything and took action. So I think it's really important to immediately go to your doctor and get checked once you see symptoms appear.
One additional ailment is fibroids.
Fibroids are muscular tumors that grow in the uterus. It's almost always benign, which means that it's non-cancerous. It can grow singular or multiple tumors, and the size range of it is like an apple seed or grapefruit. Here are some statistical facts about fibroids. They are mostly common among African women and women at the age of 30s and 40s, and also women who are suffering from obesity. The symptoms of fibroids includes painful and heavy cycles, pressure on the bladder causing frequent urination, and enlarged stomach causing women to look pregnant.
Fibroids grows in 3 categories. The first category is submucosal. The second category is the intramural. The third category is the subserosal. The medications of fibroids are birth control, which is used to regulate the hormones, morphine, which is a painkiller, and iron, which is used for heavy cycles and to avoid anemia.
Here are some ways to remove fibroids by surgery.
Myomectomy, hysterectomy, endometrial ablation, myolysis.
Scientists has also discovered new treatments for fibroids. One of those treatments is the radiofrequency ablation, which uses heat to destroy the tissue and shrinks fibroid. Also, anti-hormonal drugs, which is a symptom relief.
Or herbal remedies such as yummy pills, which is a warm detox, and vaginal steams to heal your womb and leave you relaxed.
Thank you for watching. I hope you learned about PCOS, fibroids, and ovarian cysts. If you have any questions, be sure to ask. See you next time.